Hello, this is Dr. Bruce Garber. I am a specialist in erectile dysfunction in the Philadelphia area, and in this short presentation, I wanted to review with you some aspects of the medical treatment for male erectile dysfunction. In terms of our first-line treatments, you might want to consider doing things such as losing weight, stopping smoking, getting more exercise, controlling your blood sugar if you're diabetic, and also controlling your cholesterol level if you have high cholesterol. You also want to consider changing your daily medication regimen in conjunction with your primary doc. Now, all of the above sound good. They sound like they might be helpful, and they are helpful to your overall health, but these changes very rarely work in terms of improving the quality of your erections. Now, our first line treatments for erectile dysfunction are what we call the PDE5 inhibitors. Okay, in March of 1998, Viagra came onto the market, and then in the following years, we had Cialis, Levitra, Staxin, and Stendra, and there are a few more working their way through the developmental pipelines. However, the thing to keep in mind about these medications are that they all work by exactly the same mechanism of action. They're all PDE5 inhibitors. Now, in terms of the biochemistry of erection, we are familiar with some of the biochemical reactions involved during normal erections, and what we have found is that these pills that I mentioned inhibit one step of the biochemical pathway, and the net result of that effect is that they encourage or improve blood trapping in the two erection chambers of the penis. Now, I wanted to give you a short summary of Viagra and the other medications that I previously mentioned. These medicines have really revolutionized our treatment of male erectile dysfunction. They've allowed millions of guys to get successfully treated. And overall, these pills do have a very good safety record when compared to other medications that are on the market. However, there are a number of other things that you must keep in mind when thinking about these pills. Studies show these pills only work for maybe 60% of men who have ED. So if it only works for 60%, that leaves a large number of guys who try the pills and find that they are not effective, and they need some type of further treatment. Now, some men stop using the pills because they get side effects. For example, these pills can cause a headache, they can cause flushing, they can cause heartburn or GE reflux. Some men notice back pain, visual changes, auditory changes, palpitations, a number of different side effects which can be bothersome. Other men don't find them satisfactory because these pills are expensive. Many insurance plans do not cover them, or they only cover a few of the pills each month. So on an ongoing basis, these pills can be quite expensive. Some pharmacies are charging $20 to $40 for each of the pills. Now, many men stop using the pills because they just don't work very well, or they're sort of hit or miss. One time they work, one time they don't. And another aspect is that when you're taking these pills, you have to time your sexual activity. For example, let's say you take a Viagra. Viagra has a roughly 4-hour half-life. What that means is after you take the Viagra, you've got to get the job done in about 4 hours. Otherwise, the Viagra has washed out of your system and you're right back to where you started. So this puts some time pressure on a situation where you really don't need any more pressure. So because of these factors that I mentioned, there is still a significant role for other medical and surgical treatment options. And I'm going to go over them on the next few slides. Now, what are some of our second-line therapies for ED? Well, we have things such as the vacuum pump, we have the injectable medicine, and we have the urethral medication. So I'm going to go over those with you one at a time. This is a picture of the vacuum device, vacuum constriction devices. They come in a variety of formats. One format is shown on this slide. This slide shows another format of the vacuum device. All of the vacuum devices work the same way, however. You have to take the cylinder and place it over the penis. You have to put jelly around the bottom, lubricating jelly. You have to create a vacuum to draw hopefully some blood into the penis. And then you got to put a heavy tourniquet down at the bottom. Now, these vacuum constriction devices, they're not new. They've been available for a long time. They used to require a prescription, but now you can get some of them over the counter. Many men try it, many men buy it. Very few use it on a long-term basis. And the reason is that it can be uncomfortable. The tourniquet actually cuts off the blood flow into the penis. Sometimes the penis can become cool. Many times the erection will swivel at the base, so it's really not very satisfactory for penetration. The device is cumbersome, it's messy. You certainly cannot use it if you're out on a date. And as I said, many men try it, very few use it on a long-term basis. There have not been many complications with this device, but there have been a few men who left the tourniquet on too long, and that can cause very severe complications if you do that. Now, a much more successful option is what we call the penile injection program, the intracavernous injection method. What our research has shown us is this. There are certain medications, and when you inject these medicines into one of the erection chambers, sometimes the medicine will induce an erection. There's right now one medication that is FDA approved for this purpose, and it's called alprostadil, or prostaglandin E1. The medication comes in two FDA approved forms called Caverject and Edex. If you want to try the needle program, you have to come to the doctor's office and get a test dose. You have to see if it works. You have to see if you like it and want to do something like that. You need to be taught how to properly administer the injections, and you also need to be taught how to titrate the dose, because there is some trial and error in finding the right dose that works for you. The injection is moderately effective. It works in many men. However, what I have found is that the injection program is often only a temporary solution. And that is because of the following reasons. Number one, the injection program is quite expensive. It's often more expensive than using the pills. Number two, many men find it uncomfortable sticking a needle in their penis every time they want an erection. Number three, after using the needle for a long period of time, quite a few men develop scar tissue, asymmetry, penile angulation, and what have you, and then they stop using the needle. Some men actually try to use too much of it and they overdose on the medicine, and they get what we call priapism, where the erection comes up and will not go down. And when that happens, you have to run to the emergency room. We have to stick a larger needle into the penis, draw some blood out, and give you the antidote medication. So as I mentioned, the injection is available. It's moderately effective. It does have a significant dropout rate over time. One other thing I could mention about the injection program is this. There are a number of what we call injection clinics around the United States. And these clinics mix up a variety of medicines and they sell them to you for a very, very large amount of money. I'm suggesting that if you want to use injection therapy, you can just go to a erectile dysfunction specialist, and you can get it from either a regular or a compounding pharmacy, and you will pay a lot less than if you get your medicine from one of these injection clinics. This slide shows one of the penile injection kits. These kits come available with the medicine, with the alcohol, and with the needle and syringe that you need. This shows the anatomy, and this shows how you must put the needle all the way into one of your erection chambers in order for the medicine to be effective. Now, that same medicine, alprostadil, is available in another form. This form is what we call the transurethral form, which is known as MUSE, medicated urethral system for erection. It is the same medicine, however, it's put into the urethra using an applicator, not using a needle. If you want to try the MUSE medicine, you have to come to the office, you have to get a test dose, you have to learn how to administer the medicine, and then you have to try it at home to see if it works for you. This treatment option, once again, has not met with that much success. Many men find it uncomfortable. It can cause penile or urethral discomfort and bleeding or burning. This slide shows the MUSE applicator being inserted into the urethra, and this applicator delivers a small pellet of medicine into the urethra. This slide is a comparison slide which shows the same medicine, alprostadil, when administered by needle versus the same medicine administered into the urethra. And you can see that administering it by a needle is more effective than the urethral route of administration. Now, before I end, I want to mention that there are other treatments which you may hear about. They may come through your spam email, and they may come in the form of offers to buy medication over the internet or overseas from an overseas pharmacy. I would encourage you not to buy any medication over the internet, and also not to buy any medication from an overseas pharmacy. The FDA has investigated this carefully, and they have found that if you do so, most of what you're going to get is either counterfeit or contaminated. So if you want to get your best chance of getting successfully treated, go to an erectile dysfunction specialist and get your medicine from a U.S. pharmacy. That's your best bet. In any event, that's an overview of the various medical treatments for ED. Thank you for your attention. If you want more information, please visit my website at garber-online.com for more information. And in our next video, I'm going to talk about the surgical treatment for erectile dysfunction.